My name is Dr. Marissa Blake, and I want you to settle into this conversation the way people once settled into long evenings, without clocks, without urgency, without distraction. Let this be something you do not rush through, because what we are speaking about has never rushed inside you. It has moved slowly, patiently, quietly, shaping your body year after year, often without asking for your attention. I am speaking to you as someone over 60, or as someone who loves someone over 60, because diabetes, especially the kind that appears later in life, is not merely a condition of blood sugar. It is a condition of time, of adaptation, of a body that has spent decades adjusting, compensating, and protecting you in silence. I have listened to people for most of my adult life, and I can tell you that diabetes rarely arrives as a surprise to the body. It surprises the mind because the body is so good at hiding its struggle. People say the same things to me, over and over, in different words. I didn't feel sick. I thought this was just aging. I assumed it would be obvious if something was wrong. But the body does not speak in alarms. It speaks in patterns. Diabetes begins long before a diagnosis, long before a prescription, long before a number crosses a line on a chart. It begins when the body is asked, repeatedly, to manage more than it can comfortably handle, and does so anyway. The pancreas does not suddenly stop working. Insulin does not abruptly fail. What happens instead is exhaustion. Cells that once responded easily begin to resist. Muscles that once absorbed glucose readily begin to ignore it. The liver releases sugar even when it is not needed. And the body, loyal and resourceful, compensates again. This is why so many people live with rising blood sugar for years without knowing it. Because compensation feels like normalcy, and endurance feels like health, until it doesn't. As we age, the body's margin for error narrows. What it once tolerated quietly now leaves traces. Muscle mass declines unless it is actively preserved. Circulation slows slightly. Hormonal signaling becomes less precise. Sleep becomes lighter, shorter, more fragmented. Each of these changes is small on its own. Together, they change how the body manages glucose. Muscle is one of the most important organs for blood sugar control, though few people think of it that way. Muscle acts like a reservoir for glucose. When muscle mass declines, blood sugar has fewer places to go. This means sugar stays in the bloodstream longer, even if eating habits have not changed. Many people tell me, I eat the same way I always have. And I believe them. But the body receiving that food is no longer the same body. The rules have shifted quietly. Movement often decreases with age, not out of laziness, but caution, fear of falling, fear of pain, fear of doing something wrong. But stillness changes metabolism. Without regular movement, insulin resistance increases. Blood sugar rises not because of excess, but because of inefficiency. Sleep plays a role that is rarely explained clearly. During poor sleep, stress hormones rise. Cortisol signals the liver to release glucose. Insulin sensitivity drops the next day. One night of bad sleep raises blood sugar measurably. Years of disrupted sleep reshape metabolism entirely. Stress itself deserves attention. Chronic stress keeps the body prepared for danger that no longer exists. Blood sugar rises to fuel escape that never comes. Over time, this constant readiness becomes wear. This is why diabetes is not simply about willpower. It is about environment, internal and external. emotional and physical, present and accumulated. One of the most harmful beliefs surrounding diabetes is that it only matters once it becomes severe. In truth, the most powerful moment is the early one, the years when numbers are slightly elevated, when the body is still responsive, when intervention prevents progression instead of reacting to damage. Diabetes is not a switch, it is a spectrum. There is a wide, forgiving space between perfect control and irreversible harm. And that space is where most people live, often unknowingly. Blood sugar that runs just a little high still affects circulation. Nerves are delicate. They do not require dramatic spikes to be damaged. Vision changes subtly. Healing slows quietly. Sensation dulls gradually. These changes are not immediate threats. They are slow negotiations with time. The heart is affected as well. Elevated blood sugar stiffens blood vessels, increases inflammation, and accelerates plaque formation. This is why diabetes is so closely tied to cardiovascular disease. Not because sugar attacks the heart directly, but because it changes the terrain the heart must operate in. Kidneys work harder, filtering excess glucose. Over years, this strain accumulates. Again, not loudly, not suddenly, quietly. This is why waiting to feel sick enough is often waiting too long. The goal of managing diabetes after 60 is not perfection. It is preservation. Preservation of circulation. Preservation of sensation. Preservation of energy. Preservation of independence. Movement remains one of the most effective tools we have, and it does not need to be dramatic. Walking after meals lowers blood sugar significantly. Gentle strength training rebuilds insulin sensitivity. Balance exercises preserve confidence, which keeps people moving, and movement sustains metabolism. Food is not an enemy. It is information. Every meal sends a signal. Highly processed foods send sharp, demanding signals that require immediate insulin response. Whole foods send slower, gentler messages that the body can manage without strain. Hydration supports everything. Even mild dehydration concentrates glucose in the bloodstream and increases fatigue. Water is not a treatment. It is maintenance. Medication, when needed, is not failure. It is relief. Relief for organs that have been compensating for years. Medication does not replace responsibility. It redistributes workload. Monitoring is not obsession. It is awareness. Numbers do not judge. They inform. I want to speak directly to fear because it often goes unspoken. Many people are not afraid of diabetes itself. They are afraid of what it represents. Loss of control, loss of independence, loss of identity. But diabetes does not erase who you are. It reflects how your body has survived. Shame has never improved blood sugar. Panic has never healed nerves. What helps is steadiness, curiosity, partnership. I have seen people in their 70s and 80s stabilize blood sugar, regain energy, improve sleep, and protect their vision simply by making changes that were sustainable, not heroic. I have also seen people lose years of comfort because they believed it was too late or not serious enough to matter. Aging with diabetes does not mean shrinking your life. It means refining it, choosing rhythm over extremes, choosing consistency over urgency. Your body has worked for you faithfully for decades. It has adjusted to stress, scarcity, abundance, and time itself. Now it asks for cooperation, not punishment. Move when you can. Rest when you need. Eat to support, not to fight. Sleep as though repair matters, because it does. Speak up when something changes. These are not dramatic acts. They are steady ones. And steady care is what the aging body understands best. I am Dr. Marissa Blake, and this counsel comes not from alarm, but from years of watching what happens when people stop fearing a diagnosis and start respecting their bodies, and from knowing how much life, clarity, and strength can still be lived when they do. As the years pass, something important happens in the relationship between the body and control. In youth, control feels forceful. You can push through fatigue, ignore hunger, skip sleep, recover quickly. After 60, control becomes cooperative. The body no longer responds well to commands. It responds to patterns. Diabetes teaches this lesson more clearly than almost any other condition. Many people believe diabetes management is about restriction, about saying no, about loss. But in practice, successful long-term management is about alignment. When habits align with how the aging body actually works, resistance fades, effort decreases, results improve. One of the quiet struggles people face is variability. Blood sugar is not static. It changes with sleep, mood, stress, illness, weather, routine, and timing. This unpredictability frustrates people. They want certainty. They want rules that always work. But the body is not a machine. It is a living system responding to context. Learning to observe patterns rather than chase perfection is a turning point. People who stop reacting emotionally to numbers often regain the most stability. This is especially important later in life, when stress itself becomes more damaging than fluctuation. Stress hormones raise blood sugar more powerfully than many foods. Anxiety about control can undermine control itself. This is why calm education matters, why reassurance matters, why understanding reduces harm. There is also the issue of appetite changes with age. Taste dulls, smell fades, pleasure from food shifts. People may eat more sugar without realizing it, seeking sensation rather than nourishment. Others eat less overall, losing muscle mass that helps regulate glucose. Protein intake becomes more important, not less. It supports muscle preservation, satiety, and blood sugar stability. But it must be balanced gently, without excess, without rigidity. Fiber becomes protective. It slows absorption, feeds the gut microbiome, reduces inflammation, and improves insulin sensitivity. Yet, many older adults consume far less fiber than their bodies require, not from neglect, but from habit. Digestion also changes. Meals eaten late at night raise blood sugar more than the same meals eaten earlier. Irregular eating patterns confuse insulin signaling. Long fasts may help some and harm others. Context matters. This is why comparison is dangerous. What works for one person may exhaust another. The aging body demands personalization, not trends. Diabetes also affects energy in ways people do not always recognize. When glucose cannot enter cells efficiently, fatigue follows. This fatigue is often mistaken for age, depression, or lack of motivation. People push themselves harder, worsening the cycle. Listening becomes essential. Not indulgent listening. Informed listening. Foot care deserves mention here, not as fear, but awareness. Circulation and nerve health decline subtly. Minor injuries go unnoticed. Healing slows. Daily attention prevents major problems. Again, steady care. Vision changes may appear gradual. Blurriness that comes and goes. Difficulty adjusting to light. These are not reasons for panic, but for monitoring. Early changes are manageable. late changes are limiting. Kidney function, too, benefits from early attention. Adequate hydration, blood pressure control, and glucose stability preserve filtration capacity longer than most people realize. Social life plays a role that medicine alone cannot replicate. Isolation increases stress hormones. Shared meals improve regulation. Conversation stimulates movement, purpose, and routine. Loneliness is not just emotional, it is metabolic. This is why I encourage people not to retreat from life after diagnosis. Diabetes is not a reason to withdraw. It is a reason to simplify, prioritize, and stay connected. Many people fear medication escalation. They see it as a failure, but bodies change, needs change. Treatment changes are adjustments, not judgments. Pride has no place in physiology. What matters is reducing strain on organs, on vessels, on nerves, on the mind. And the mind must be included. Diabetes carries emotional weight, fear of complications, guilt over food, frustration with variability. These emotions matter. They influence behavior. Addressing them openly improves outcomes more than silence ever could. I want to say something that may feel uncomfortable but is important. Longevity with diabetes is not achieved through intensity. It is achieved through sustainability. People who burn themselves out trying to be perfect often quit entirely. People who allow themselves to be human persist. Persistence is powerful. There is also wisdom in routine, regular wake times, regular meals, regular movement. The body thrives on predictability as it ages. Predictability reduces glucose swings. It reduces stress responses. It increases efficiency. When routines are disrupted, travel, illness, grief, the goal is not control, but recovery. Returning gently to rhythm. Diabetes does not define the end of anything. It marks a transition into a more intentional relationship with the body, one that many people wish they had developed earlier. I have watched people discover strength they did not know they had, not through struggle, but through steadiness, through respect, through patience. And patience, above all, is what the aging body responds to best. Your body has not betrayed you. It has adapted for decades. Now it is asking for collaboration. Move thoughtfully. Eat attentively. Rest deliberately. Monitor without fear. Adjust without shame. These acts may seem small, but small acts, repeated calmly, reshape biology over time. That is not optimism. That is physiology. I am Dr. Marissa Blake, and this counsel comes not from urgency, but from long observation, from seeing what happens when people stop fighting their bodies and start working with them, and from knowing how much life, independence, and dignity can still be lived when they do. I am Dr. Marissa Blake, and this counsel comes not from alarm, but from years of watching what happens when people stop fearing a diagnosis and start respecting their bodies, and from knowing how much life, clarity, and strength can still be lived when they do.